In this lesson, we're going to talk about glomerulonephritis. As you can deduce from the name, this is inflammation, that's the itis, in the glomerulus of the kidneys. Remember, nephro means kidneys. So remember from anatomy that the glomerulus is the little tuft of capillaries that sits in Bowman's capsule and it filters the blood into the nephron. So it forces the blood out through these capillary walls like a strainer, and that fluid gets collected in this tubule and goes through the nephron to be excreted as urine. So, glomerulonephritis, like we said, is inflammation of the glomerulus due to some sort of immune response. Common predisposing factors are things like upper respiratory infections, skin infections, or autoimmune diseases like lupus. Now, these things cause this immune response that comes here into the nephron, and it can cause damage in here into the glomerulus. So if this gets all inflamed and swollen, it's going to really struggle to filter blood like it should. So what we essentially see is that the kidneys stop doing what they're supposed to do. So if the blood can't get here through the glomerulus into the nephron, then we can't filter out the toxins. We also can't regulate our fluid and electrolytes if that fluid's not even in there in the first place. And our kidneys are also going to struggle to retain that bicarb buffer for acid-base balance. So, in addition to seeing those signs of infection because of inflammation, like fever or possibly increased white blood cells, we're also going to see evidence of impaired kidney function. Now, that azotemia, that's your increase of your nitrogenous waste products in the blood. So that's when you start to see things like your BUN and creatinine elevating. That's going to cause things like anorexia, nausea, vomiting, malaise. People are just going to be fatigued. The retention of water and sodium is going to cause hypertension and volume overload and edema. And then something else that we see is that the kidneys aren't actually uptaking or excreting dye with a renal scan. So when we inject contrast or dye into the kidneys, we see that they're not actually filtering that dye into the kidneys like they should. So what do we see in our lab values? Well, first and foremost, we're going to see a decreased glomerular filtration rate. Now, I've said this before, and I'm going to say it again. The GFR is the number one indicator of kidney function. And we'll still see increased BUN and creatinine, but since they're not always specific, looking at the GFR gives us an even better picture of what's happening to the kidneys. Now, we'll also possibly see hematuria, which is blood in the urine. We can see proteinuria, which is protein in the urine. Remember, in the nephrotic syndrome lesson, we talked about how glomerulonephritis can actually lead to nephrotic syndrome, where they start dumping protein into the urine. When they dump that protein into the urine, then they have decreased protein in their blood, hypoalbuminemia, and all of that can lead to even more edema. And then, of course, because we lose that bicarb buffer, the kidneys stop holding on to bicarb like they're supposed to. And so that leads to this metabolic acidosis. You'll see a pH less than 7.35 and a bicarb less than 22. So, our goal for management of these patients is going to be to decrease whatever inflammatory process caused the problem in the first place and prevent any long term complications, especially permanent kidney damage, because that can actually lead to chronic kidney disease or CKD, which we'll talk about later. So, we'll give corticosteroids to decrease the inflammation. We'll also do dialysis to support the kidney function until we've addressed the source of the problem. Now, we can also do something called plasmapheresis. Now, this is a plasmapheresis machine here. It's similar to dialysis, but the goal is actually to remove some of the harmful antibodies that are in the system that are causing this immune response. And so we filter the blood through the plasmapheresis machine. Those antibodies are filtered out, and then their blood is returned back to them. We're also going to put some restrictions on their diet, including protein, potassium, sodium, and also they'll be on a fluid restriction. We know that kidney failure comes with hyperkalemia, so we make sure we restrict that potassium intake. Now, I want to make something clear. This is a huge caution, is that Salt substitutes that a lot of people will use when they are supposed to be on a low sodium diet are actually made with potassium chloride. So we want to make sure that kidney patients don't use salt substitutes. They need to just not use any salt because otherwise now they're giving themselves potassium and that's really dangerous. Um, Again, the goal here is just to avoid the hyperkalemia and avoid that excess fluid retention. And of course, because of that, we're going to measure strict intake and output. We're going to take daily weight so that we can see if they're retaining any fluid. Remember that 1 kilogram of body weight equals 1 liter of fluid retained. So, our priority nursing concepts for a patient with glomerulonephritis are obviously fluid and electrolytes and elimination, because we know this affects the kidneys, as well as infection control, because we want to assess that source of inflammation and prevent any further urinary tract infections. Check out the care plan attached to this lesson to see more detailed nursing interventions and rationales. Now let's recap quickly. Glomerulonephritis is inflammation of the glomerulus caused by some sort of infectious process or immune response. This means that our kidneys are not going to be functioning appropriately. So we're going to see this decreased GFR, azotemia, which is your increased BUN and creatinine, and it causes many other problems as well, and volume overload because of all that fluid retention. We want to decrease the inflammatory process and stop that immune response that's causing the problem, which is where plasmapheresis comes in to remove those antibodies. All the while, we want to support the kidneys. We can use dialysis to do that, as well as medications. And we want to prevent long term complications like chronic kidney disease. So that's it for glomerulonephritis. Make sure you check out all the resources attached to this lesson to learn more. Now go out and be your best selves today, guys. And as always, happy nursing.